Hello there, my name is Daniel Video, and I'm here to give an interprofessional in-service regarding a specific patient population, and that patient population is heart failure. The context of caring for heart failure patients can be in the hospital, clinics, home health, and pretty much any setting, but for this context, we'll talk about the hospital setting. Now, as nurses, we work with heart failure patients on a daily basis, or at least come into contact with potential heart failure patients given the prevalence of risk factors in the general population. My job here today is to educate you on heart failure patients in order for you to provide optimal, patient-specific, and patient-centered care. Smart outcomes. Our presentation's specific end goal is to have you able to identify common risk factors in the heart failure population, be able to identify common signs and symptoms of heart failure patients, and be able to identify and recommend treatments for this population. Our goals are specific and will be measured using a post-presentation survey that we'll distribute at the end of the presentation. We will consider this 15-minute presentation a success and that we achieved our desired goal of educating all of you by the answers to these survey questions. Our presentation is fast and focused, but it will give you all necessary information to gain knowledge on this population and give informative, patient-centered care. Now let's get started. As we stated, the population we will focus today is the heart failure population. Heart failure is a more common disease than most people understand. 6 million Americans and 23 million people worldwide suffer from this chronic, progressive, and debilitating disease. If we look around this room, 1 in 5 of us will develop heart failure at some point in our lives. And this unfortunate statistic is that diagnosis holds a 5-year survival rate. The typical heart failure patient is an African American male, 65 years old or older, overweight, and a smoker. But minorities in general are more likely than white individuals to suffer from heart failure. The goals of care for heart failure patients are simple. Prevention of disease occurring and prevention of disease worsening. National standards are striving to improve overall health in heart failure patients and those that are at risk for developing heart failure. Specific goals include decreasing those that are diagnosed with heart failure, specifically the minority population and those of lower socioeconomic status. Goals of care also strive to decrease complications caused by heart failure and contributing risk factors such as strokes. And financially, goals of care are specific to decreasing readmission rates to hospitals. All of these goals have subsequent smaller goals that address improving disease management through improved nutrition and commitment to exercise. This will also include pharmacological regimen and care coordination of disease management. The overall goal is to reduce patients' risk for developing heart failure, and if they do, the goal is to manage heart failure so complications are reduced. Given the 5-year survival rate that a diagnosis of heart failure carries, heart promotion and risk reduction are the utmost importance. First, let's talk about risk reduction because the risks are minimized, then the chances are developing heart failure are minimized as well. Minimizing risk factors such as coronary artery disease, hypertension, obesity, and smoking will greatly reduce the risk for developing heart failure. In terms of health promotion, diet and exercise are always first on the list. If a well-balanced diet and regular exercise are incorporated into everyday life, then a large portion of diseases in this country would be reduced. All interventions have some aspect of education incorporated, specifically diet. A multifunctional diet consists of grains, vegetables, and fruits. Natural foods, unprocessed foods that are high in antioxidants and low in glycemic index are recommended. Diets low in sodium, sugars, and fats will decrease the risk of developing high blood pressure, diabetes, and coronary artery disease, all which are contributing factors to heart failure. Consistent exercise, 30 minutes a day, 5 days a week of cardiovascular workout is recommended to achieve healthy heart. Consistent exercise will condition and strengthen the heart, as well as decrease excess weight and strain on the heart. The goal of these interventions is to reduce the risk of heart disease and promote the overall healthy lifestyle. The pathophysiology of heart failure is a complex process that is similar to a runaway train that devastates the entire body by affecting all organs. Heart failure develops from being overworked. With diseases such as diabetes and coronary artery disease and obesity, the heart must pump harder than what is expected. Diabetes produces viscous blood that requires the heart to work harder to allow for blood flow to continue. Coronary artery disease causes an accumulation of plaque buildup within the lumen of the blood vessels, reducing the circumference of those vessels. The heart must work even harder to pump blood through those narrowed vessels. And obesity. Moving a 300-pound person takes much more energy than someone who is lighter and physically active with a well-conditioned heart. Over time, the heart must pump harder and faster to keep up with metabolic demands. The increased stress of the heart causes myocardial cells to become damaged and die. The heart no longer has thick muscular walls pumping effectively and forcefully with every beat. The remodeling process over years of being overworked will cause an enlarged, stiff heart with dilated chambers. Heart failure is a cyclical problem. The body creates an environment where the heart must work harder to sustain life, but in turn the heart actually becomes weaker. The symptoms associated with heart failure are a direct result of the heart becoming an ineffective pump and unable to pump blood and oxygen and nutrients that need to be delivered. In order for the heart to continue to perfuse the body's vital organs, the kidneys are stimulated to retain salt and fluids in the vascular system. With the increased fluid in the vascular system and the heart ineffectively able to pump it, fluid will begin to enter the interstitial space throughout the body, but mostly in the edema that will develop in dependent areas such as lower extremities. As the heart failure disease progresses, the weakened heart will continue to be unable to keep up with additional workload, and blood will back up in the venous system. Fluids will then leak into the lungs and cause shortness of breath and decreased stamina. It is not uncommon to see heart failure patients gasping for air after walking a short distance. A cough will develop as congestion worsens in the lungs, inhibiting the exchange of oxygen and carbon dioxide gases. Edematous extremities and poor perfusion by the weakened heart will also result in cool extremities and weak, irregular pulses. This is the heart's desperate attempt to perfuse the body by using increased and effective heartbeats. Upon assessing a typical heart failure patient, you will see the causes of heart failure in every body system. From your general survey, you will typically see a patient that appears lethargic, pale, and short of breath. Neurologically, the patient may be intact but will have bouts of disorientation and lightheadedness when overexerted due to decreased oxygen delivered to the brain. The patient may also complain of blurry vision and seeing spots. In regards to the cardiac system, upon auscultation, you will likely hear an S3 heart sound with a murmur due to regurgitation from the mitral and tricuspid valves. Weak, thready pulses will be felt due to the weakening and ineffective pumping of the heart. Heart failure patients are often out of breath, especially during exertion. JVD and rales may be present from the congestion in the venous system that is leaking into the lungs. Patients may have epigastric fullness, and upper right abdomen may be tender to palpation from the congestion buildup in the systemic system. Patients may also complain of excess urination because the kidneys are attempting to remove this excess fluid from the body. This will lead to interrupted sleep. From the lack of sufficient oxygenation from the weakened heart, skeletal muscles will receive poor perfusion and decreased stamina and strength. The patient may suffer from status dermatitis and have dry, flaky, cold skin. Heart failure patients typically complain of headaches, shortness of breath, inability to sleep, increased urination, poor appetite, and heart palpitations. As you can see, the entire body suffers from this disease process. Now that we have seen what a typical heart failure patient looks like from the outside, let's take a look within. No one test will diagnose heart failure, but lab results, assessments, and diagnostic data will be analyzed to confirm heart failure. Typical lab results include the ones mentioned above. Other than BNP and NT-proBNP, the others can measure the severity of risk factors, such as diabetes and CAD. BNP greater than 400, proBNP greater than 450, hemoglobin greater than 6.5%, oral glucose tolerance test greater than 200, and lipoproteins and fibrinogen can all be used to diagnose heart failure and its risk factors. Diagnostic tools such as echocardiogram and an EKG, as well as coronary angiograms, can be used to determine the severity and the causes of heart damage. The echocardiogram measures the size of the heart and the ejection fraction, the percentage of blood expelled from the ventricles during contraction. Normal is between 55 to 70%, and anything below is considered some sort of severity of heart failure. An EKG can be used to see if the heart has abnormal rhythms or ischemia due to heart failure and its risk factors. A coronary angiogram can be used to invasively see where the blood vessels are blocked and if their heart is not perfusing adequately. This procedure can also be used to provide the opportunity to unclog and remove plaque to reduce the stress of the heart and decrease the workload. In treating heart failure, you could also treat the underlying causes. Since heart failure is caused by hypertension, CAD, and other comorbidities, we must treat those in order to reduce further damage. Giving antihypertension such as ACE inhibitors like lisinopril or beta blockers like metoprolol, we will treat elevated blood pressures. Angiotensin receptor blocking agents and vasodilators will also are other methods used. Statins such as Lipitor are used to decrease plaque buildup, increase coronary perfusion, and reduce the risk of heart attacks. Diuretics are used to expel excess fluid from the body and reduce the volume needed to be pumped by the heart, hence reducing the workload even more. Fast-acting insulin such as regular insulin and longer-acting NPH, as well as diabetic medications such as metformin, are all used to control diabetes. Non-pharmacological treatments are plentiful. A multifunctional diet of whole grains, vegetables, and fruits will provide the essential nutrients for the optimal functioning body. Eliminating foods high in sugar, salt, and fat will reduce exacerbation of risk factors. Adequate exercise, 150 minutes a week, will produce a well-conditioned heart. There are also natural products such as red ginseng that have shown to lower blood pressure, but please be careful with these therapies and consult your doctor before beginning these therapies. As you see, heart failure patients are affected systemically. Mind, body, and spirit are all under distress when diagnosed with heart failure. Treatment takes collaboration. Cardiologists may be used for their expertise in diagnoses and performing procedures such as coronary angiograms. Nephrologists may be consulted to determine the best treatment to reduce the potential risk factors for kidney failure. Dietitians will be needed to establish a well-rounded complement diet that will slow the progress of the disease. Heart failure patients are likely to suffer from polypharmacy, so a pharmacist will be needed to optimize the best patient-centered regimen to reduce drug interaction complications. Counselors will also be needed since the diagnosis of heart failure can lead to social isolation and depression. And a care coordination or nurse practitioner needs to advocate for the patient and facilitate care. Heart failure patients will see best managed care and optimal outcomes only from patient-centered team approach. Our take-home points. We have talked about how heart failure is a progressive incurable disease that has a 5-year survival rate. It is important to diagnose and prevent further complications through risk factor management. It takes a systemic approach to diagnose heart failure and takes a holistic approach to treat in the using of pharmacological and non-pharmacological modalities. And collaboration is the key. Please fill out your post surveys, and we want to see if you can now successfully identify risk factors for heart failure, common signs and symptoms, and common treatments. Our hope is that you have gained the knowledge to identify these patients in your practice and be ready to recommend care for your patients. As nurses, the more knowledge we have, the better care we can give to our patients. Thank you for your time and allowing me to speak with you on this very important topic. I will be around a little after the presentation to answer any questions. Thank you again.